Evening, everyone. We ready? All right, we all set?
Yes, we are.
Should bring the meeting to order. Our first agenda item is approval of the minutes. 2 meetings that were in the packet.
I looked at them, I had no comments.
Mr. Chairman, if I may, before the motion is made, Maureen picked up a change. So Dr. Beck's motion at the last full board meeting, we did not put in the entire text. So if one of the members can make and she's updated it, can make an motion to accept the minutes to include the full text of the board's order to adjust its face covering, order, I would appreciate that.
Thank you, Larry. I was about to make the same comment because I think it was important for us to reaffirm that even though we were sounding like we were decreasing our scope, we didn't want to make it, we wanted to make it clear that how important it was still to maintain those precautions.
So can you, Larry, specifically state what we need to clarify?
So on the meeting of September 16th, include the full text of the motion
Regarding the face masks.
regarding face covering. That is correct.
That's a good catch. I make a motion that the meeting minutes from September 16th state explicitly that it will include the full text in the motion regarding face masks.
Second, all in favor?
Second.
Thank you. And now we need a motion on the dog hearing.
What is the motion on the dog?
To accept the minutes.
Minutes.
Oh, so there's not a distinct motion regarding the dog hearing, just a motion to accept. Oh, a motion to accept the minutes from the dog hearing and a motion to accept the minutes from the September 16th meeting. Okay. I make a motion to accept the minutes from the dog hearing.
Seconded.
All in favor?
Aye.
Aye. Thank you. Okay, I don't see any public members tonight. So here, seeing none, we'll move on to the next agenda item, which is COVID-19 updates.
Mr. Chairman, if we can adjust the agenda to take the farmers markets update first, I would appreciate that, so we can get Stephanie's presentation out of the way. Because I have 3 of them that I need to do with you.
Okay. Stephanie, you're on.
Okay, great. Thank you. So just wanted to share an update about the farmers market, which wrapped up last week. I know you all received an update about 8 or so weeks ago, a little beyond mid-season, just to kind of give you some highlights and let you know how things were going. And I'm sure you heard that it was going well. And so I'm happy to say that now that we're beyond the season and looking back, and it was, everything went better than anticipated. And honestly, we didn't know what to anticipate with such a different year and so many rules and restrictions, but we consistently had really good attendance. We had really good compliance. We had a lot of good feedback. We increased our SNAP numbers a little bit, which was a challenge because we're obviously not getting everybody, including seniors this year, who just are choosing not to come out for the obvious reason. And we didn't have anything COVID related come up that was major. And that was, I think, everybody's, big fear that there'd be a spreading event or something. But overall, it went really well. Vendors were happy, customers were very happy. Couple of things that came out of it that are sort of continuation of the market is Dick's Market Garden, our big produce vendor, is going to be continuing to offer a fall CSA through the end of the year. And this began as a pilot with the state. So they're partnering with Department of Transitional Assistance, who handles all SNAP, food stamp related programming. And the target for this was really to be able to get Watertown residents who receive SNAP benefits a free produce box twice a month as part of their Healthy Incentive Program benefit. And we didn't quite hit that target in that we only have about a third of signups, maybe a quarter to a third of signups that are SNAP customers, but we had a lot of interest from the general population who were happily buying the pre-order box from Dick's, and they loved the option to be able to continue into the end of the year. So we're doing that with them. We're just putting the final touches on. We're working with housing and some of the town social workers. We're still trying to do a lot of SNAP outreach. There are, about a couple thousand people that are registered for SNAP benefits in Watertown, and more than double that are eligible and not registered. But of all those people, we're only reaching a small amount who are using the Healthy Incentive Program, which, just to remind you all, it is anybody who receives SNAP benefits or also receive HIP. And it can only be used at a farmer's market, a farm stand, a mobile market, or a CSA. So you can't use it in a market, a regular store. Even though Amazon and Walmart take SNAP benefits now, you can't use the HIP at any other place. So trying to get folks to utilize that free $40 to $80 a month, which is processed as an instant rebate for produce only, has been now we're in year 4 of trying to grow this program. So the state put $5 million into it earlier in the pandemic. So we knew the funding was solid through this year. So that's been one of our goals. So we're happy to have this opportunity with Dick's to kind of, especially if we, go into another, phase of the pandemic where people really don't want to go out. We're hoping we can continue to enroll people once things get going. So I can.
Stephanie,
Yes.
do they have to, if they accept the produce, does that decrease the amount they can get from regular stores?
No, and that's really the key part that people don't understand. It does not affect their SNAP benefits. And this pilot program with the state has really made it seamless. So they're not making people have a balance. Typically, you have to have the balance you want to use in your HIP on your card, but they've created it so it's so simple to use with this pilot program. But despite, I think our really good efforts, people just don't understand what the benefit is. And in today's day, you can't really get in and talk to people like we have in the past, face-to-face, do a workshop, kind of walk them through it. So where, I did a little session, a Zoom session for some of the Wayside staff and social workers who are working with a lot of SNAP residents. And it's still hard to relay the information. It's hard for people to believe they can get this, free food on top of their SNAP benefits. So it's an ongoing effort, but it's great news that we have this continuing program with Dick's. And one other tie into the market as a follow-up is our Eat Well Watertown program, which is healthy eating and cooking. We'll also tie in, we'll be having our Eat Well chefs, who are all volunteers, put information in on, how to cook with a lot of this produce you're going to get in the box. So they'll continue to do, everything will sort of shift to virtual. So it's definitely a connection, although a separate program from the farmers market. So we're kind of working on a fall season program.
Stephanie?
Yes.
I know Red Fire Farm has a fall program.
Yes.
Are you involved with that in terms of where that will be taking place? Because that's a real service to people in Watertown and in neighboring communities.
That's right. And I just spoke with them again today. They've asked for help in finding a host site. And it's tough with COVID. I mean, we can't do it. The town can't do it. They need an indoor space. So whereas Dick's, it's going to be a little bit different. It's going to be, you have a 1 hour window to come get it off the truck. It's definitely not like hosting a whole program, but I'm giving them ideas of people they can reach out to. But I think because of COVID restrictions, it just makes it really hard for somebody to just use someone's indoor space unless it's not being used right now. So they are working on it, and I will try and get the word out a little bit more for them. They're trying to gear up for that to start up again in just a few weeks.
And have you been working with the food banks as a way to get people to know about the SNAP benefit?
Absolutely. So the Watertown Catholic Collaborative Food Pantry has been picking up all season. So they pick up the donations from the vendors. And I'm part of a resiliency coalition in the town right now through the Watertown Community Foundation and various stakeholders, including the senior center and the food pantries and the library. It's a really big stakeholder group. So through that group for the past 3 months, I've been doing a lot of outreach and education. So the word is out. The word is out. It's really the tough part is just getting people to enroll. It is a 3-page contract. It takes time. If this continues on, we might be able to grow it more in the late winter, early spring when there's more available, and we just keep this effort up.
Stephanie, is there any sort of quantitative number of people who have used the market or been through the market, or how do you compare year to year, and how are we doing? Because this is with the new with this location as opposed to back when we were at the Arsenal.
Yeah, so this is year 2 at Salt and Stall, but a very different year, as you know. So what we saw this year, which is very interesting, it's the first year that we used the clicker. Maureen knows because she's helped out. So we click people as they come in. So we're getting an exact count as opposed to past years where we did an average, we'd count every half hour. But we also know because vendors are confirming how well they're doing. So they really can kind of, sort of confirm that this is, in comparison to past years. So we had between 450 and 600 a week, which in comparison to past years was really good weeks. To hit the 500s were our really, really good markets. And we also brought in a lot of new people. We guess, we'll see with our survey if we get a lot of responses. We think we were bringing in maybe 50 to 100 new people a week. We did informal polling every few weeks. I'd have a volunteer say, is it your first time? Every second or third person, just to kind of get, some sense of who was who outside of the real regulars that So I think it's just because so many people are working from home. So they're coming, they have the time, they're trying it, they're looking for things to do in the community. So whether or not, it'll bring in regular customers over the long run is yet to be seen. But I think a lot of the reason we did so well was because people are around town during the day and they're looking for outdoor, it's an outdoor market in the summer when there's not a lot of other options. So I think that helped us a lot. It introduced people to the market and what's available. So we're hoping that we retain a lot of those people.
How about the availability of online ordering?
It's excellent. through the pandemic, when a lot of the vendors who were at winter markets had to shift gears instantly in March, they partnered. They're using, third party sort of platforms. Most of them, some of our big vendors are doing delivery right to Watertown. They pick a day and they do all the surrounding towns, and many do home delivery. So there's some great options.
That's great.
Yeah. So, we'll just have to kind of see where things go in terms of getting back to a more normal market next year with programming and some of the other things we were starting to build on, that all had to get paused this year, obviously. And they did. Sorry, Richard.
I'm sorry to interrupt you. Would you say that the pre-ordering was a big factor, a big number?
I do.
And is that something that post-pandemic they might consider keeping anyway?
Yes, hopefully. And I think the good thing about having the pre-ordering is that it committed people to coming. Whereas, if you're just going to maybe shop or maybe not shop, you don't go. So that did help our numbers too. And I do think many will, continue over the off season with utilizing some of our vendors.
Yeah, I just think that so many things that we've learned, that we've adapted to with the pandemic are going to carry over in all areas of our lives. And that seems like one of those things that if it works so well, maybe there's no reason to not continue it.
Well, I just learned recently that Newton decided to continue beyond their season to do not drop off, but drive through. So they're going to have about a third of their vendors come into Newton on Tuesdays and do a drive through with pre-order only. I mean, they probably took some time to organize it. We did not put that effort in. We didn't make that decision, which we would have had to have done quite some time ago to do it. And then it's the space, they have a nice big space over by Newton South. I mean, they're town run, they're city run too, but that's something that would take a lot of organizing. I think depending on what our lifestyles look like going forward in 2021, we'll have to kind of maybe test something like that out. I think if there's a demand for it and we can manage it, it'd be a great offering.
The nice thing about pre-ordering is that you're going to get what you want.
Yeah, that's right.
And, Amazon's been next to useless at times because they don't deliver within any kind of reliable time frame these days. So just calling a local store and knowing that you go to a local store online and ordering it and knowing it's there and then just going and picking it up is.
I think it also reduces impulse buying.
Yes, that's right. It's hard to resist some of the good stuff they do have when you come to the market. And I think a lot of people really, truly want to support local right now. They know how tough it is for, a lot of especially smaller businesses. And to think that the options would just be really, big entities doesn't appeal to a lot of people. So it's great we have, support. Yeah. I know I'm on a limited time and maybe Larry wants to table it for another meeting, but at some point it would be good to share some of the other community wellness programs that, mostly ongoing, but just switching to virtual format because that's really the only option. So.
Yeah, maybe we can do that next month because it was not an agenda item.
Yep.
That's great. Thank you. You will understand if you don't listen to the rest of the meeting. Thank you.
Yeah, I might just listen to the COVID update. Everybody's busy, so just in case there's anything I haven't heard yet.
Okay.
Thank you.
Who's going to do that, Larry?
Yes. Just wanna bring up my. Okay, so currently we have 551 cases, 18 active cases, and within the last week we've had 15 new cases. We've also had no fatalities. Most of what we're seeing in family spread most of it is associated with social gatherings and not maintaining social distance. On the flu shots, we've had a total of 503 done so far.
Larry, you said most of them were associated with social gatherings. Were these social gatherings where the numbers exceeded what the target is?
No, it's people going out to family gatherings, etc., and getting infected.
What is the number for a family gathering? Is there a number?
I don't have that number. What I know is that we've moved from green to yellow, and in the last week we've had 15 new cases. So that is going to push us forward. Some of it is probable because many people are going and they're doing antigen tests, and those are considered probable. The only confirmed testing that DPH is accepting and counting right now are PCR tests.
So, Barbara, go ahead.
How difficult is it to get tested? And I remember about a month or so ago, I wanted to get a test and I had to wait well over a week to get an appointment. And then I think the turnaround time for the results was 3 days, but it seemed at that point it took a long time to get an appointment. Has that improved?
It has improved significantly. Getting tested is no longer a challenge. There are some specific sites that we have listed on the website. And there are many private testing facilities, especially the pharmacies, and there's some walk-in clinics. But I would suggest if you are going to get tested, confirm that they are doing PCR tests and not antigen tests, sorry.
Okay.
So is Will able to keep up with the contract chasing for the department? I know he's
The workload is increasing. So somehow we're looking to right now searching for some additional help for him, at least to get through the end of the year. And the challenge is finding someone who is adequately trained, who can really assist him, not just anyone.
A lot of municipalities have cross-trained other staff who, because of the pandemic, have been furloughed or laid off or just don't have as much on their plate. And they've cross-trained and utilized them as contact staff. Have we thought about that, or is that a possibility?
We're exploring all possibilities. He is reaching out to his networks, as well as I'm going to be doing the same with mine.
And have you utilized the CTC, or are you considering adding them to?
We are utilizing the CTC. The challenge is that we're using them for contacts, not primary case, because the data we're getting back is really challenging. For example, we would normally continue follow-ups with people. If they make 2 calls in one day, that person is reported as lost to follow-up, which is not a good thing for us. The other challenge we're facing is that there's inconsistent standards in reporting. So today he had a case reported as positive, which was 7 days old.
No, that's not good.
And we had one last week that was 10 days old. So some places are doing roster reporting instead of reporting immediately, or they're positive. So it is presenting a challenge to us. See,
All
what
right.
we're looking for, in response to Richard's question, to what we're looking for is someone who we can really have trained, have an understanding of Maven, to assist them in getting the data into Maven and doing the follow-ups that way.
So I like it that Will, on his reports that we see, tells us the number of active cases rather than just the total that's since March, which is not useful anymore. So but I don't see that getting carried around. I mean, get carried into the manager's report or publicly. It just seems like that's an important number.
The active cases, they
Yeah.
usually reported in the manager's report, if my memory serves me well.
Okay, well, maybe I may have missed it, but I again think that that's an important number to keep in mind. And
Yet,
I assume that's what determines the color.
yes, no, it is the number that is reported within the jurisdiction. And the impact, while you may move from one color to another, the impact is really, if we move from yellow to red, it's only going to impact us if we're in the red for 3 consecutive weeks.
And what do you mean that will impact us? How would the state respond?
Okay, so for example, if the schools have to make a decision to go from hybrid learning or in-person learning to remote learning, that is only going to be impacted if we are in the red for 3 weeks.
Well, do you know what offhand how many cases we would have to be in the red based on our population?
Off the top of my head, no.
I saw it on the news this morning. Watertown schools had a major segment. There were questions about to go fully remote, even though we were not in the red zone. Does that sound correct? There was pushback from the state. Are you familiar with that?
So yes. And I'll start by saying the Department of Public Health censored me yesterday on the Department of Public Health call where they refused to take a question, although from me, despite there being 13 minutes left on the clock. And I was told it was because I was going to ask a question. They thought I was going to ask a question about the commissioners of DESI's order that they're going to audit the school department. The challenge that we faced, I have been in touch with the school department since early in the COVID outbreak. We have been very cautious in our approach, making sure that everything was in place because we know things can change almost immediately. And all along, Desi was saying to us, yes, this is the guidance. However, the decision rests with the local school departments. When the school department made their decision, it was not in keeping with what DESI wanted them to do. So they threatened audit. And the school department responded that, you've told us that we can make, or we should be making the decisions locally, and it is a local option. Yet you are threatening us with audits, and the school department, in the best interest of the students in Watertown, they knowing what is happening in their in the community as against people who are sitting in offices in Medford or Malden. So they went ahead and they decided to follow up with their threat, and the school department is now going to be audited.
How do they connect, Larry, I'm sorry, how do they connect auditing with the decision to go remote or not? Auditing is usually a financial process, correct?
Well, it was their big stick. So if you don't do what they want you to do, we will beat you over the head.
Yeah, it just sounds like a punitive response that has nothing to do with the core concern, based on what I'm hearing.
It is absolutely, and that is one of the reasons why they censored me yesterday and refused to take my call. And I was not going to ask a question about the audit because I believe that questions surrounding the audit were within the purview of the school committee and the superintendent, and they had it under control. I was going to ask a question about PCR testing and clearance to return to work after coming from a community outside of Massachusetts that is a high-risk community. But
Lara, what was what made the school department decide that, was that in conjunction with, do you think they were making the right decision? And what drove them to that decision?
during the process, we really had to look at where COVID was going. And we decided to take a very cautious approach to it, knowing that coming back in, if you go full all in person, coming back in, and people are coming back from holidays, you don't know where they've been, and we're seeing huge increase in cases among the school age population, actually. It would increase geometrically. So that was one of the concerns. So the cautious approach was to start remote, move into a hybrid, keep observing, and when we're happy that it is working well, then move into an in-person. Desi's belief is that they should have gone immediately into an in-person. And
100% in person?
pardon me?
They believe the school should have gone completely in person from the beginning?
Yes.
But the governor says he's not going to vote for Trump, but never mind.
Was the school committee decision to start remote, et cetera, impacted by the teachers and the staff within the schools? Or first, do we have a union representing our teachers? Because I know there's been a lot of concerns from the union about returning to work into a risky or dangerous environment.
They do have a union, and a lot of the questions that you're asking are not within the realm of my responsibility. So I really want
Right,
to.
I understand. I was just asking for information. Yeah.
Yes, they do have a union, and I believe that they were consulted. But what I can say is the decisions were making in consultation with many and taking into account risk and spread of COVID-19 in the community. The decisions were made with the best interests of our community as against the best interests of individual political rationale.
What about special needs kids? Is there an exception for them or not?
Yeah, they're being taught.
Good. Because I think Boston's about to say even they can't come anymore, which is really going to.
Many communities and other communities surrounding us are, most of them are in the red. It's only the communities that are to the north of us are still in the green. Waltham is in the red, Boston is in the red, Cambridge is going there. I mean, it's you know, exactly. And remember, we're 4 square miles with a very dense population. So when we do have spread, it's going to spread rapidly.
As it, go ahead.
Sorry.
No, go ahead. Go ahead.
No, that just seems like it might be helpful to know what number of, if we're at 16, what number gets us from yellow to red, and the other way, how do we have to get to green? It would be useful to know that number, and maybe sort of challenge people to do that. Because now when you say 16, it's kind of hard. 16 out of 35,000 doesn't seem like a big number.
Yeah, it would be helpful to know just how far away we are from being red. Do we have any kind of margin?
Yeah, I'm looking for the map right now.
It has a number on it. I mean, the colors are based on the,
On numbers.
it does say what the cutoff is, so we just have to adjust it for the population.
So it's got to be just percent positive, right?
It's, yeah, greater than 8 cases per 100,000 will take us into the red. 4 to 8 per 100,000 is yellow.
And we're at 35,000.
Mm-hmm.
So a third of that. So yeah, so I mean, that's a small number.
Mm-hmm.
Yeah.
So 16 is going to get us in the red if it keeps up, right?
Yeah.
That's correct.
And they're doing a 7-day week to week trending. And that's what you said. So we need a 3-week up and above that number to push us into the red.
No, 1 week will push us into the red. We'll go into the red, but the impact of being in the red is not going to be felt unless we've been there for 3 weeks.
Okay.
So it sounds like we don't have much wiggle room.
No.
As an aside, I reported something to Will today regarding known contacts in a house in Watertown from my community of LaSalle. And Will responded pretty quickly to my email and was on the case. So I was impressed that, and now given what you've been sharing about what he has on his plate, I'm doubly impressed that he responded pretty quickly.
I can say that Will really is a great professional. He takes his job seriously. He goes out of the way to get the information and to assist people and to stop the spread of COVID in this community. Yes, he does get frustrated at times because of the lack of information that's coming to him or the delay in getting him the information. And it really presents a significant challenge for us if we're going to be doing this together and expecting it to the spread in the community to stop. But he related that situation with me, and in fact, we were happy that you brought that to our attention because, it was a really interesting situation.
So did he not get it? Why wouldn't that have been reported to him already? Why did he?
So yeah, let me explain, John. And we've alluded to that. The MAVEN program. There's steps, right? So every lab has to report to MAVEN, and it reports out to local boards of health depending upon the address of the individuals. I'm in a unique situation working with the Broad Institute that for my community, I get the test results as soon as they're available. Literally 3 in the morning, I get a message on my phone. And so I take the lead for my community and I do the initial contact tracing and contact investigation. In this case, we identified a student who lives in Watertown. And so I immediately notified Will, gave him all the info that he needed to move forward. He might get this information 4 days from now through the Maven system. But my goal is to hit it as early as possible.
Yeah, that's great.
To minimize any kind of spread. So that's how it came about today. And that's the basics. Yeah.
You know, all he's been doing, the community does owe Will a lot. It's strange to see Will is organizing flu clinics. He's going and doing flu immunizations, and still he's doing all this contact tracing
That's great.
on weekends as well.
Yeah.
So do you think we need, given what Rich just had happen today, do you think we need to make more, make providers in the community more aware that please don't rely on Maven? If you have a patient who's positive, please call Will right away.
That's
a great idea. It's a great idea. The urgent care centers that we have in town.
And the primary care offices, not too many.
Right.
But, you know, I think it's a really great suggestion. Unfortunately, we can request it, we can't require it.
Right.
Right.
But I think docs would probably, whoever, would go along with it because they want the best. They don't want other people in the family to get, in the community to get infected. So.
Well, not really true, because we have one situation where major provider would input data into their system, it gets into Maven, and no contact information is put in. And I have to, I'm reaching out to them tomorrow morning to have a discussion with their CEO about that. We can't do contact tracing without contact information or how to reach this person.
So is that lack of education on the part of those individuals, or what's going on?
No, with this particular situation that I highlighted to you just now, I think it's more a case of indifference or believing that they need to protect patient privacy, not being aware that, and they should be aware, because we have had discussions with them, because they wanted to do the contact tracing for their patients, which we're okay with, because there was a pilot that was done in another community. But we need the information. If you're going to put in the information, put in the information completely, not piecemeal. Because just a name without a date of birth, an address, contact information does nothing for us. We spend more time trying to find out where this person is living in town and how to get hold of them than anything else. In the meantime, they're positive and they have the likelihood of continuing the spread, because they may not be aware that they need to quarantine. We don't even know if they need additional services that we're able to provide them.
That's really surprising, Betty. I know, because the state requires that information on all tests. Just what you identified there, and that's been messaged to all providers, that they have to have these certain pieces of information whenever they order a test. This particular test. So that's really disappointing if someone is not doing that.
But if it's a system that has its own lab, it gets very tricky. I feel like it's a big. or they're part of a big system.
Yes.
Okay. Any other COVID issues? I think that Larry, do you think that this is worth some publicity? I mean, being surrounded by the Reds and Reds towns and being not at a good place ourselves, we should make people more aware so that they would maybe be more careful.
Yeah, we have started messaging, and to be quite honest with you, I don't know how much more messaging we can do. We have been messaging and sharing the information since March. Yet still, right now, there's a group that is out on the basketball court behind the Boys and Girls Club at Saltonstall, playing basketball every day, no face coverings, active games, and it's not permitted. And I've asked that some action be taken, and everyone's throwing up their hands. I went out once and I was soundly reprimanded, and that is putting it lightly, by the people there. When I spoke to them, I am not going to put myself at personal risk to do that anymore.
It shouldn't, a $300 fine is going to stop them playing basketball.
But who's going to do it?
Oh,
Is that why we have a police force?
Yes, and I'll stop there.
Yeah, but should the Board of Health make a recommendation? I don't know. I think we need to think about that a little bit because, well, it may be too late. I mean, we're really, we're not as bad as the Midwest, but we're not looking good either.
No, we're not. And
500, 600, 700 a day across the state.
And I suspect that if the trend continues within the next couple of weeks, residents of Massachusetts are going to be asked to, or be prohibited from traveling to states without, are not going to be allowed in without a test, or they're going to have to quarantine when they go to those states. Yeah. Because we're trending upwards.
Is there, to circle back a little bit, what type of support or additional support is being discussed for Will in that role? Because I anticipate it is going to increase, not decrease, in the near future.
Yeah, I'm going to have I tried to meet with the town manager today, but he was extremely busy. He has indicated to me that we will have a discussion tomorrow because the new CARES Act funding applications are coming up within the next 2 weeks. So for that, I'm looking for him to ask, but I need at least one more body to assist him. And I do have some funding that I can pay for that until the end of the year. But the challenge that we're facing right now is to actually find that body.
What about other departments? And I ask this because I've got the wife of one of my nephews works for the library system in Los Angeles. And they've commandeered them to be contact tracers, right, which is something that's great for librarians because they like data and they like information and they're detail oriented.
Mm-hmm. That's a good suggestion. The person what we're looking for must have some type of epidemiological skills to do the contact tracing. And they must be able to be trained and allowed to have a Maven account, because part of the challenge is with the cases that are coming in, they have to be entered into Maven. And we're seeing challenges even with when we go to the contact tracing collaborative, getting adequate data or them doing the job adequately on the contact tracing side. We're okay with having them do the secondary contact, but we want to manage all the primary cases ourselves.
It just, Barbara, I know I've heard of other towns that have used librarians because they're so, they tend to be very data oriented, and they're particularly someone who's worked in doing research librarian work. They can find anybody anywhere. So
There's two recognized programs, the John Hopkins 6-hour program, which gives you a certification for contact tracing. And there's another one I think is actually Massachusetts based. I'd have to look into that. But typically for these positions, that's one of the things they say, you know, if you're not already experienced, that you agree to do this training, et cetera, in order to accept the position. So that is out there. You don't necessarily have to be an epidemiologist unless you choose to hold that high standard.
Yep. We're considering every option that is available to us and trying to think outside of the box, because we don't want to be stuck in any rut.
Yeah. Well, if they do find the resources and they create a position, there's a job posting. If you would share it, I do have connections in that area.
Oh, excellent.
And with others within the nursing field, that I think you might find the correct resource there.
Okay. I will do that. Will and I will have a meeting on a number of issues early, and as we're on this, in fact, I'll take it up later down in the meeting on the staffing updates.
okay, so we should move on. Anything more to say about the flu clinic?
I know they're continuing, and we will continue to vaccinate. This weekend, we have the senior clinic taking place at the library. And in 2 weeks, we have another drive-through clinic. We have learned a lot from the drive-through clinic. It was really challenging for us. Simple things like having tent weights and having more A-frame signs. Moving the walk-in vaccinations from where we had it to a site that's really closer to Main Street. You know, having briefings at the beginning with the operations team, and having specific briefings with the people who are just doing the greeting and guiding of people throughout the clinic. What worked well for us too was having the paperwork online. Though some people turned up, they were doing something else, and they saw a flu clinic today, let me take the opportunity. And we were happy to vaccinate them, because, you know, it wasn't about a paperwork, it's about getting that shot into you, because we need to vaccinate the entire community. And I think at this level we're at with 503 within a 2-week period, it's a 3-week period, sorry, we're doing really well.
Larry, are they doing the double high dose for senior citizens
No, we're doing the quadrivalent.
for everybody?
Yeah. It's two things. It's a matter of when we're doing the clinic, it does impact the amount of time that you have to vaccinate if you're doing two different um, types of vaccine, because not only do you have to trace, make sure that you have the right batch on your paperwork, you have to make sure that it's going to the right people. And there's also a significant cost difference between both. And as you all may be aware that the high-dose vaccine really is recommended for a specific group of individuals at a specific time. So really later down or right in the middle of flu season when you need immunity rapidly. That is why we're trying to vaccinate people now, so you have the 10 days to build up the immunity in your system.
So how does the protectiveness of that for the seniors compare to the high-dose senior vaccine?
I think the quadrivalent that we are administering, and I will stand corrected here, and I don't want to guess, but I believe it really does give longer immunity, but it does take a longer time for you to gain that immunity. Flu season is not with us as yet. We're now starting to get into it. We're probably going to be peaking in January, February. I think that with the high dose, it's a 4 to 6 day period, while the quadrivalent is a 10-day period to get.
Are you getting from the state vaccine program? Is that where our vaccines are coming from?
And it's both the state impasse use. In fact, what they're doing now is they're only providing to uninsured, and we have purchased vaccines.
Mm. So the town is billing insurances?
Yes, we do roster billing.
How's that working?
It works well.
Okay.
The big challenge really is to get the information into MIS.
Yeah. Has the town spent the money for the automated transfer of info? There's 2 programs with the MIS.
That's not ready yet.
Oh, okay. Yeah, there's a lot
They're
of work.
being trained on it, but it's not ready yet.
A lot of work if you don't have that system.
Right, it would work really well, but the system isn't ready.
The other question around the high dose vaccine, the reason I brought it forward, local pharmacies are reporting that they can't get it, that it's already short, and that's why I was thinking if the health department had the ability to get vaccine, and if we were considering it for our senior citizens, you would want to do it sooner rather than later. Even if you don't use it right away, there's going to be a shortage. It's already happening.
Well, we're anticipating, because the flu vaccine is being recommended for everyone. I'm having flashbacks to H1N1, where the seasonal flu vaccine just ended up being in short supply because everyone wanted to be immunized, and the recommendation is everyone gets the flu vaccine. So we do anticipate that there may be shortages. I know they haven't shifted to making any other vaccines because there's nothing approved as yet, but it's in high demand all around. Hopefully the state will say, remove their restrictions for uninsured and say, just here's the vaccines, just vaccinate whoever wants it. But you never know. And then again, since I am blacklisted, we may not get any.
Well, in higher education, they mandated the flu vaccine, right? For and So that's having a huge impact, obviously, in our area. The demand is just incredible. It's really nice. We had 2 clinics so far, and we did 600 and 480 2 clinics in 2 days. We worked with Walgreens, contracted with them to be the vendor, the provider, and the first day they ran out of vaccine. They didn't bring enough, and they verbalized as well that they're having trouble finding vaccine already.
Mhm.
So
Fortunately, we still have a good supply, and we will continue vaccinating until our supplies run out, which we hope happens, by the way. I would rather
Right.
have all the vaccines used for people instead of having to return vaccines at the end of June.
Yeah.
As long as we're not having to turn away people who want to be vaccinated.
Yes, that is exactly it.
But again, I would like to recommend, if you can, the high dose vaccine. We have a large senior population, and
Rich, do you not, I mean, Larry's thing idea that if you're giving it now, well before flu season,
Yeah.
or hey, with
Yeah.
right.
Yeah,
I'm
we won't get right
suggesting
now, we won't get it.
I'm suggesting try to get it in hand. You don't necessarily have to administer it now, but I would suggest trying to get it sooner rather than later and store it till you think it's appropriate to administer.
Okay.
Thank you. SSRS.
Yes, I've provided you with a copy of the SSRS report. This is the first quarter report in fiscal year 21, sorry. So the needs are going up, as Jenna stated, the challenges that we're facing is parental assistance, but there is money out there. And in fact, I received some information today from Senator Brownsberger, as well as information from the state recently, that there is a significant amount of money there available for rental assistance. So Jenna is working with people to develop eligibility, etc. The other challenge we're facing too is food security. And the feedback I am getting from the food pantry and Council on Aging, who manages the food pantry, we have had, since COVID hit, about 100% increase in our food pantry clients. And I think what is unfortunate too, as Stephanie was saying, is that the food is there, it's available for people, and if we could only get them to use that benefit, because it does not impact their eligibility to purchase food at other places. And as you can see from the report, $7,500, $100 Stop and Shop gift cards were distributed to families impacted by COVID. I'm not going to get into a lot of it right now at this time of the year. We're probably going to get requests for heating assistance if there's anything out there. And yes, the big thing as I said before, right now is rental assistance because people aren't working and they have to pay rents.
So, Larry, I thought the report was very comprehensive and well done. I was a little curious that there's not a category around mental illness in terms of what kinds of contact. Is that because we're not able to really determine that? Or, I mean, I just wonder that it seems that is thinking, you know, hoarding, whatever, that was an important function of us having a social worker. And I just was a little surprised there wasn't some kind of category.
I can ask that. I think it's more of a matter of divulging information.
Yeah.
But I know you're asking about, if I understand your question, it's more about generalities
Yeah.
instead of specifics.
I mean, the people coming to our social worker, because that's her skills, particularly, I mean, obviously anyone who needs food or housing, I mean, that's great, but we could actually not have someone who's a licensed social worker doing that. So I want to make sure that we're reaching the component of the community that is struggling with behavioral health issues.
I will ask Jenna.
Thank you.
All right, so staffing and department updates. Both, we are fully staffed, as you're well aware, and the training for the staff is coming along really well. Both the health officers have passed their first certification, so they are now both certified food managers. They have to do, because we are enrolled in the FDA retail voluntary retail program standards, they have to do 40 inspections accompanied, then they do some unaccompanied, and then I have to send them out or have someone come in to audit their performance. And once that is done, they're going to be ready to perform independently. Because they came with some understanding, they are addressing many of the nuisance complaints on their own. So that is really heartening, where I can have both inspectors going out to some sites, and the communications they're having there, it's really, really good with them. So they're eager learners. I am doing a lot in-house with their training. In fact, we had a discussion about 2 weeks ago on Dr. William Gorgas, who is not one of the celebrated heroes in public health. When you bring up his name, people say, who? When we talked about draining the swamp, well, this is a guy who actually drained the swamp and controlled the spread of yellow fever and malaria in the Panama Canal zone, and also instituted a number of good sanitation measures, moving from water in cisterns that came off roofs into pipe-borne water, which also eliminated mosquito breeding places. So I had them understanding that we talk about indoor air quality issues, venting, how to utilize their moisture meters and how to measure moisture in a building and what the recommendations will be. So it's fantastic to see them grow.
That's great. Congratulations.
You mentioned that they have to do number of inspections with your oversight or with some oversight, et cetera. And given the current situation, are you able to do that? Are you able to go out to sites and do full inspections?
Um, it is not convenient, so but we are doing some. Most of the visits are spot checks and complaint response as against full inspections. However, we do have some new establishments in town, and they have been on all those opening inspections. One of the last ones, I did it with the entire team when we went out to open up number one Taste on Galen Street.
Yeah.
How many indoor restaurants do we have operating now compared to, say, a year ago?
I don't have that figure before me.
Yeah,
Indoor restaurants.
I'm just wondering, is it like half of what it used to be, or do you have a sense of how much it's gone down?
No, I think it's a very small amount that have closed permanently. It's about 3 of them, from my understanding.
Selena's being one. That was very sad.
Whom?
Stelina.
Well, Stelina is actually looking to sell. So the family had closed their restaurant. And when they found out that they had to return their liquor permit, they had to submit close their food permit out. They decided to renew both because the business is up for sale. So it's not going to be gone. It may come back as something else, but the location is going to be a restaurant in future.
Oh, that's great.
What about Arsenal Yards, the movie theater, any of the other establishments? Do you have an idea of the status of those places?
I don't measure the economics of the business. What I do know is the movie theater, they were allowed to open. The state has increased the capacity for the movie theater, and they're also allowing the sale of prepackaged foods at the concession. So that is helpful to them.
I didn't know they opened.
Yeah, they're open. The movie theater is open.
Oh,
The Frank Pepe's Pizza, all the food places are open.
okay.
I had a question for the board, and I know I've had this question answered previously, but I just want to confirm. Routine requests for variances where we review and everything, do you want that to come to you, or is this something I should continue doing? And only if there's regulatory action that has to be taken against the facility that they come to you. Because it has been the norm for example, the way our body art regulations are written, and we have to really look at including a clause in the body art regulations. Many of the practitioners are going into single-use pens and tips. There's nothing refillable anymore where they have to use autoclaves, but because our regulations are written the way they were from a number of years ago when the technology was different, someone who wants to use disposables has to apply for a variance. This is something we are doing in-house. It's the same thing if someone has in a food establishment, they're not doing a lot of food. For example, they're serving only coffee and donuts. And instead of investing in a expensive 3-bay sink, they can use a dishwasher instead. because of space constraints, and we will grant those variances once they have met all the other requirements of the code.
I think we've decided in the past that we didn't need to review, only needed to review if it's a new kind of variance that we've never even thought about before, and we ought to make sure that it makes sense as much to protect you guys as anything else. So that, but if it's one of the common ones that we always say yes to because it makes good sense, I don't know how the rest of the board feels, but I don't think we've seen any need to see those.
I think that makes sense. There have been other times where we've had to weigh in on variances, for example, relating to building or interior building permits, where if someone wanted to have, you know, like a 6.5 foot ceiling instead of a 7 foot ceiling, then the health department would get involved. Which also seemed things like that we didn't really need to get involved because it's a fairly minor difference, and it was something that was reasonable in that example because it would be an older house. So I think that you're right, John. Variances that are something that we would always grant and are not anything unusual. I don't think that there's a role for us.
Well, the one that comes to mind for me is the swimming pools. They've all kind of been unique in one way or another, but our findings have been consistent. So I'm not, you know, I guess I'm thinking we probably should look at those, for instance, because there's enough variables. Does that make sense?
Are you saying that we should look at variances for swimming pools specifically?
Well, yeah, you know how the lifeguard on duty or not on duty, related to the size of the pool and the residence usage. So I'm afraid if we do a blanket yes, you know, variances don't by the board, we could miss something where we should have had input.
Larry, my impression also has been, which, you know, you again can use with some discretion, is that with some folks, it makes sense to have them come before the board so they understand the importance of we're giving them a variance, but it does mean you can do anything you want, right? You still have to respect the spirit of the regulation and what's being trying to be done. And even though you're getting a variance, like even the, you know, that it's still important. So I think sometimes we've had some people who have come before the board as much to get to hear the importance of the issue as it is that we're going to make a decision, yes or no.
Right. And it was just as when CityWorks was coming into town and they wanted to have open windows. That is something that I felt was complex enough, and it was not straightforward that I needed you to weigh in on it. That is why I brought them to the board and have them understand that because of what they're doing, that is out of the norm, that the board had to weigh in on this.
And sometimes it's, I think we've had some situations where it's been a bigger corporation and having them have a formal board hearing has gotten used, just not the local manager, but corporate to come in and hear they got to take this seriously.
All right, so if I have any doubt, and I think I have a fairly good command of what simple and complex variance requests are, and if I have doubts, I would run it by you, Dr. Strauss, and ask for your opinion.
Yeah, that's fine.
The other thing I had to ask you is setting up your next meeting. There is a conflict that night. 2 meetings are scheduled at the same time. If we were meeting in person, that would not have been an issue because we would have all been in different rooms. but we're occupying the same bandwidth online now. So I'm going to send you an email tomorrow with some suggestions. One of the considerations, of course, is moving to another day, and I've gotten some suggestions on it, and or whether or not you believe you need to meet. And I think that would all depend on how COVID transpires and what else happens in town. And it's scheduled for 2 weeks after the November elections. It's scheduled for the 18th. So I have a suggestion, I believe, for the Monday. I'll forward you the email and hear what you say. But if you're okay with not meeting that night, that would assist the ZBA in having their meeting.
You usually can be pretty flexible, so give us the dates and we'll let you know.
All right, great.
Larry, I was wondering, what's the story with the dangerous dog? Has there been compliance?
Yes. Karen validated that, well, the muzzle she had, she didn't have the muzzle on the dog properly. So there was an attachment that needed to go around the dog's head that she was not putting on properly. And she did get insurance in a very short period of time. Karen is keeping an eye on it, and there's no, she saw no challenges or no non-compliance issues. I think that the dog owner, Ms. Baker, really got the board's message loud and clear that if she fails to comply with the board's order, the dog would be taken away from her. As well as she's looking to move out of town, so she really wants to stay under the radar until she has the opportunity to leave. So
I'm
Karen,
glad to hear. I'm glad to hear she's doing everything. That's good news. Yeah.
And she said she would be moving out of state, so it wouldn't be in our, or I mean, in theory, you know, other towns in Massachusetts would still have the same dangerous dog, but if she moves out of state, then that declaration wouldn't be in our bailiwick anyway, but I assume it wouldn't apply elsewhere.
yeah, anywhere she goes, and if they ask a question, has Jake ever been deemed to be a dangerous dog, she has to say yes, and there's no need for us to rescind the order or change anything.
Right, it's just that the tracking gets very difficult.
Right.
in Massachusetts.
Yeah, but once he leaves Massachusetts or leaves Watertown, he's no longer in our jurisdiction.
Like many things that go interstate, there's no communication, unfortunately.
Yeah.
Okay. Have we covered everything on the agenda? I think so.
Right.
Anything we didn't anticipate?
Oh. And I decided to change it from meeting planning to that because there may be some burning issue
Yeah.
that comes up the day of the meeting or after the agenda has been posted that you can't discuss unless it's an item there on the agenda.
Yeah, that's great. That's a good idea. Okay, so until November, everyone's stay safe and wear your mask.
Okay, so long.
Thank you.
Bye now.